All right, and welcome to what will probably be our final regional report out call. We're here in the Southeast region. It's our ninth time to be together as we're going through the pandemic, and with numbers getting better. And when you see me go through the dashboard, you'll see that we're feeling like this is a tool we can put on hiatus and pick back up later if we need to. With that in mind, we'll say a lot of thank yous, I'm sure, on here. And I thank you for my regular participants that are all here. No one involved in this project is getting paid extra money to do it. Just people volunteering for their region to help get a picture of what's going on and report out each week. So very grateful for all of you here with us today. We'll get kind of more on where we're going from here. But let me start with the dashboard and the data. The dashboard is going to look a little different than it has on some past ones. This is a rolled up dashboard for the state. February 15th is the information. We're looking at this blue line here, Southeast Kansas. Thought it'd be interesting to look back, close to a month ago on January 18th, where we were, to show some of the progress that's been made. So when you think about hospitalized COVID patients, we were at 53 on January 18th, down to 15 here on February 15th. In the ICU, we had 16 COVID patients. We're now at 4 in the Southeast region. Coming to available ICU beds, we were at 8, and we're now at 18, up from 25% to 58% capacity in the ICU areas. Now, these are all point in time, but it does give you an idea of the progress that's been made. I'll come down here to the Southeast region too. This is the number of cases, a later spike than what we had in the rest of the state, but we have seen as we came into January, now into February, the ski slope we wanted to, where the case counts is dropping on a weekly basis here. Now, we always want to see case count go down and the positivity rate go down as well. And so this is a little dash that the Kansas Department of Health and Environment puts together for us. The Southeast region, you want to be in a yellow or blue, ideally, but you can see, really since we came into January, where we had a positivity rate, I can't quite see on my screen there, sorry about that, of 12.17%, now is dropping, week over week here to last week being 7.6%. So we want to keep pursuing that blue, but it is getting better and is mirroring the cases, which is really good. While I have you on my screen, I'm going to come over here to kansasvaccine.gov. This data tab here continues to be show progress also. 2 weeks ago when we were together, it was at 6.5% of Kansans vaccinated. We're now at 10%. We know that there's still a data lag on this information. So we are north of 10%. We don't know how far north, but that's good. We're north of 100,000 people that are fully vaccinated with the second dose, which is good too. But I just keep, it's good to come back and check this page every so often. You can see we're getting more Moderna in now, which is easier to transport. You can see what's going on daily with the vaccines administered and what's coming into your county here. Also, the Find My Vaccine tab is getting better, I'd say, week over week. And you can scroll down here and see your region of the state. It'll populate where there are vaccine sites available. And you can click on it. I'm just picking one here, and it'll show you. This is Chanute at the Women's Health Center. So they didn't get their doses this week, but you can still check and see, how you can get an appointment there if that's the closest one to you. And they're continuing to dial this in with the new retail pharmacy program also. So that's my report out on data and the vaccine website. But let's hear what's really going on in the region from the people that are doing the work, and we'll kick it over to Destiny Wheeler from Wilson County. Destiny.
Hello, John. And first of all, I want to thank you for putting these calls together, or these meetings together. I think they've been really beneficial over the last 9 or 10 weeks because, like you said in your very first one, healthcare is regional, and we need to know how each other are doing before we can really do our jobs well. We are in the region seeing less positive tests. We are seeing less tests, but as you pointed out, our percent positivity is decreasing. So I think that really points to the fact that we're testing who needs to be tested still, and that it's not just a fluke. I think that we are really slowing down on our new cases. Um, we public health wise are working through these vaccines. There's some shipping delays this week with the bad weather and road conditions. So we haven't gotten any this week yet, but some allotments have gone up. I know my county's doubled, so that was fantastic news. And like you said, the pharmacies are getting vaccine. I actually just found out today one of the pharmacies in my county is receiving vaccine I didn't even know they were getting. So I think that is a testament to our communication, that we weren't told that they were going to be, we knew they were going to be a provider, but we didn't know when they were getting vaccine, and for us to already have that communication in place was really beneficial to us in the county. And luckily they're a smaller pharmacy. So I know that some of the larger pharmacies may be harder to get that kind of communication, but I just wanted communication is so important. And I just wanted to kind of point that out just, while we were talking about it. Everyone pretty much is continuing, everyone in our region is continuing to prioritize by age and exposure. We're hitting those congregate settings, those essential employees that just cannot take that time off. We've got to have food, we've got to have shelter, we've got to have electricity, and we're getting all of those people taken care of in this phase. And it seems to be going pretty well. I think for most everybody, we are all kind of doing it a little differently, but same at the same time. Lots of drive-through clinics. We're not doing drive-through clinics, but it's exciting to see how everyone attacks the challenge, and we're excited to have a positive thing to be proactive and not just constantly reacting. So that is really nice. I think, the only other thing that I did want to mention was that we are starting to see second infections in some people. We know that CDC and KDHE have said that people have an assumed immunity for 90 days after they recover from COVID, and for many people that 90 days is up. The way that we're working through that is utilizing the strengths of each of our tests. So we know that the PCR test is incredibly accurate. So if we get a positive PCR test on someone who is still within that 90-day window, we rely on an antigen test to verify that, whether it's just picking up on a past infection or it's actually a new infection. So that's been kind of an interesting learning curve in the past few weeks that we've kind of stumbled into, but it all seems to be going pretty well. It's slightly disappointing that the immunity doesn't last a little longer, so we can reach herd immunity more efficiently. I guess we're going to have to go ahead and vaccinate people that have already had the disease. So which we're obviously willing to do, but it would be nice if that immunity lasted a little longer, but it doesn't. So I think that's basically it in the world of public health in Southeast Kansas.
Thank you, Destiny. Appreciate it. Great report. Let me kick it over to Bruce. You hear from hospitals.
Sure. Kind of like the dashboard reflects, John, our numbers are on a similar trend. I didn't have a chance to check with Drew Talbot today, but I know last week we only had just a handful of patients, COVID patients in our hospital in Pittsburgh. our vaccine process that we're engaging in for our internal associates. We will be through that process by the end of next week. Then we will kind of turn our focus to working with our local counties to determine, what role we can play in assisting them in vaccinating, kind of phase 2 population. And I think, like Destiny said, we've been encouraging some of our associates who have contracted COVID, particularly if they're at that 90-day period, to make sure they go ahead and get vaccinated, if they're willing to do so. And we've had a pretty high percentage of our associates have taken the vaccine, which is a good sign. And so again, numbers are looking positive. But again, I think hopefully our general public, we don't, again, as we've talked in previous calls, let our guards down. The virus is still out there. There's variants of it out there, and we want to keep pushing the numbers down, not see another spike. So that's kind of what I have today, John.
Thanks, Bruce. I've been also hearing just about people with deferred care and seeing issues start to arise with that, and encouraging people,
Right.
if you've deferred preventative care or thought there's issues and been afraid to go in, now's the time to go in.
For sure. Yep.
Right. We also have Brian Williams with us from Labette County. He's been a regular for us. Give us some boots on the ground reporting. Brian, what are you seeing besides water mains going out?
Yeah, so I think similar to Bruce and Destiny, so we have a weekly call at noon on Tuesdays with really all the hospitals in Southeast Kansas. And today, Labette Health had 25 patients in the hospital, 3 of whom were positive COVID, no COVID patients on ventilator. And I believe Coffeyville Regional Medical Center reported 3. That's certainly down from the 11 or 12, that we've had in the past. I mean, it's a much needed respite, for everybody to kind of catch their breath. But I think, like everybody said, still be vigilant in wearing masks, still be vigilant in washing your hands and social distance. The vaccine's not hey, I don't have to wear a mask anymore and I get out a free jail card. Vaccinations, I think Southeast Kansas is really, the county health departments have done a good job trying to bring people together. Vaccinations we want everybody to get it. We want to get it in people's arms as quickly as possible. But KDHE's put guidelines out there, and we're all trying to follow those guidelines. Right now, we're continuing to be focused on 65 and older. We've administered both Pfizer and Moderna primary and secondary doses to all of our employees, staff, team, and then we've started assisting the county health departments in Montgomery. A week or so ago, we had a collaborative event in Independence where we administered doses to the public, 65 and older. We've done the same thing in Neosho County, working with Neosho Memorial and other hospitals and the county health department to do Erie and St. Paul. Labette County asked us to administer vaccines in Chautauqua, Oswego, and Altamont. So, really, I think everybody's kind of come together, led by the county health departments, to provide resources. We've got Labette County has 4, I think, nurses, and we have 866 employees. So I think that's all really that I have to report. I don't want to say that we're in a downward trend because I don't want to jinx it. You never want to walk down to the ER and go, oh, you guys aren't busy, because then, 3 ambulances come in. So I think the message to viewers is we needed a break because the resources of all the hospitals were stretched beyond anything that you could ever imagine or anything we've ever experienced in the history of our country, and help us with staying vigilant to social distance, thin yourself out in restaurants and family events, and just help us keep the trend going down.
I love you highlighting the partnerships. I really think, we're seeing that out around the state, and the groups that are the most efficient at getting that vaccine out. are partnering and communicating with each other, like Destiny pointed out. And I've been hearing a lot of that on this call in particular for the Southeast region. So it's great. We have Dr. Watson with us from Cheyenne Mountain Software and the Mission Control app. He's update us on what's going on with the transfer situation. Has some good news for us today also. Dr. Watson, let me make you the host so you can present here.
Yeah, great. Great to be on, and great when the news gets better each week. I mean, I just, so many times we've talked about all the problems in the system, but, we're seeing the majority of the hospitals are returning back to capacity that would normally be expected this year. Certainly the flu and the influenza demand is way down from where it usually is. A little bit sad to hear about second infections in people. I think there's a whole mess that we may need to deal with here, but spring spike, we're just hoping everybody gets vaccinated to be able to at least blunt that spring spike. The numbers look really good here. 10% of the transfers are COVID positive. Only 13% of the time are we needing to find beds for facilities, and all of the transport times are approaching right at that 1 hour mark. So good news across the board. Capacity exists. Times are going back to normal. The number of COVID patients are decreasing. We really are trying to make the case for people getting into the ER when they need to, get into their physicians, don't delay care, get back with the regular programs of health maintenance. Delayed care is going to end up costing us as well. So really encouraging people to be about the business of taking care of their health.
Thanks, Dr. Watson. It's great to see so much green on the board, the numbers coming back down, and some relief for the system, like Brian shared. Much needed, not only in resources, but people just needing that break. And if we can amp up the vaccine rollout, and we did get to hear from Dr. Nielsen today, who's helping coordinate that effort for the state. And she was saying, I asked her to pontificate a little bit on the next 90 to 120 days, some things to look forward to, so that the retail pharmacy program should be bringing more vaccine into the state. The feds are saying that they'll be producing and able to get more into the state over time. And the hope is that the Johnson & Johnson shot will come on the market by the end of the month. And that's a one-shot vaccine, not a two-shot. So that, and it travels very easily, even easier than Moderna. And so we'll need to begin to anticipate sometime in the next 90 to 120 days, shifting from a place of where there's way more demand than there is supply of the vaccine to a place where we have ample amounts of the vaccine, and we need to be concerned about people being concerned about taking the vaccine and helping people feel better about that. We'll be relying a lot on physicians networks. People trust their doctor on that to help people walk through what vaccine means for them, what it means for our communities, and being able to move on. Also watching the UK variant, we knew we had caught one of them in Ellis County, just popped up in Sedgwick County this week. That is what's the early studies are showing to be a little more contagious, a little more lethal. I don't know what the right word is there. So that a lot of people believe by the end of March, that'd be the more dominant variant. And so that's the pressure I think everybody's feeling to get vaccine into the arms of the most vulnerable before that happens and before the possibility of a spring spike. So it's the partnership, it's the communication, and it's the hearts of the people like on this call that are getting it done. We like to end with bright spots, and I got a great one out of Southwest Kansas here. It's from the YouTube page. It's a beautiful day in our neighborhood, not your neighborhood, like Fred Rogers, who's great. Two folks from Southwest Kansas, one a physician's assistant, Aaron Keeley, and a medical professional, Rachel Svati, were talking about some of their Somali neighbors and how to get vaccine information to them in their language. And so they decided they'd record a conversation about vaccine in with a Somali translator. And you can see that down here. And what they found was there was so much need in that part of Kansas. I think in Garden City High School, there's 15 languages spoken. I think between Garden City Liberal and Dodge City, over half the households, English is not their first language. So look what they did. Out of their love for neighbor, they had this conversation with an Arabic translator, a Vietnamese translator, a Burmese, Spanish, Somali, to get this out into people's first language. As we talk about vaccine hesitancy, hearing about something in your language is going to help you understand it and feel more confident to take it. But what I love most about this and what we've seen, this is two people in the medical field loving their neighbor. And that's what I feel like we have seen over and over again as these bright spots is people in county health and in hospitals and in all sorts of places love and care for their neighbor, bringing goodness into this world and kindness and love and their service to others. And just a whole group of people have really poured themselves out, and they are to be celebrated and thanked. And this is just a great example of the way people have risen to the occasion in so many ways that will never be recognized, but as they care for their neighbors and the people and the humans sitting right in front of them. So I want to thank this group. No one on here getting paid extra to be here, like I said before, just out of the goodness of wanting to serve their community. And so, they have to get their arms around what's going on in the whole region before these calls and let us know. And everybody has something else they could be doing. I guarantee it. Destiny, Bruce, Brian, Dr. Watson, thank you. We've got Megan and Ryan behind the scenes who have been really helpful in getting the emails out and all the technology pieces of this. We're very grateful. Anything you guys would want to say before I sign us off here?
Thank you very much, obviously.
Yeah. It's been a privilege. Been a privilege to get to know so many wonderful people. And I'll go back to restauranteering or touring, whatever it's called. I should know that one. Selling scrambled eggs and burritos and stuff. That's what I'm good at. So we're grateful for you all and grateful to state now. If we do need to pick this up again, you can go on to covid.ks.gov/report-outs and put in your email address, and we'll let you know if we're going to need to do this again. Our hope is that you can stay warm and stay healthy, and we're grateful for all the people out there inspiring us every day, including this group. Thank you guys very much, and have a great day.